Welcome, everybody, to another one of our Boroughwide updates. We're still experimenting with this format, so give us your feedback. But we're going to go over 4 topics that I think it's important you know about. We're going to take some questions from some reporters, and then we're going to take your questions, which you can post on Twitter with the hashtag Manhattan Update. Hashtag Manhattan Update, and we'll get to your questions. We're going to start off today by talking about a topic which is, I think, on all of our minds: the crisis of mental health and public safety, which has so afflicted Manhattan and the city. Since we last spoke, we had the horrible murder of Michelle Go on the Times Square subway platform. Just last week, we had the horrific murder of Christina Lee in Chinatown. And the causes in each of these cases is different, and there have been many more. But we know enough to say we have a broken mental health system. And so I'm pleased that at this very hour, the mayor and the governor are offering an update on their action plan to address mental health challenges in the subway system. It is really great to see their emphasis on social service outreach teams, offering medical care and counseling to people who are in crisis, and also their commitment to expanding the number of Safe Haven and other inpatient facilities. I want to emphasize right now that we're facing a real crisis in access to inpatient psychiatric care because Manhattan has lost almost 500 inpatient beds over the past decade, and even more during the COVID pandemic. We want to reverse that trend. It's too hard for people in crisis to get access to inpatient psychiatric care, but we also need facilities for people who are discharged from hospital and are not yet ready to return to their communities. So those are known as medical step-down beds. There are very, very few that are targeted for psychiatric patients. This is something we could expand, perhaps partnering with our public hospital system and some of the great nonprofits doing this work. We're going to be focused on this intensely in the weeks and months ahead as we review the mayor's new plan and as we prepare for the budget process taking place now in New York City between now and June. So stay tuned on that. But we're already focusing intensely on one way that the subway system can be made more safer, which is doing what's been done in dozens of cities around the world, installing screen doors on subway platforms. Now, this would prevent horrific cases like that of Michelle Go, where someone's pushed. Thankfully, as awful as those are, they are rare. But people wind up on the tracks hundreds of times every year in the subway system because they fall accidentally, because they're trespassing, unfortunately, because they might be attempting suicide. In fact, in the last 48 hours, we had 6 people hit by trains in New York City. The details on all those cases are not entirely clear, but it does appear that at least 2 were fatal, not foul play. Tragically, it appears it may have been a case of suicide. But nonetheless, these are the kind of tragedies we could prevent with installation of this proven technology. The MTA has released a 4,000-page study it has done on the feasibility of screen doors throughout the system. And they have identified almost 130 stations where, according to their criteria, which is pretty conservative, they believe screen doors are feasible on subway platforms. And so we, for the first time, have compiled this with our great partners at Beta NYC into a map which you can see. And what's quite clear is that there's at least one subway stop where screen doors are feasible in just about every neighborhood in New York City. So our call to the MTA is start installing this technology. Let's say you pick 1 or 2 subway stations in every borough, so we have some equity, and let's get moving on this in order to protect riders and make our system safer. We're going to put that graphic you just saw at the map up on social media. I'm sure it was kind of hard to see right here on the video, but we want people to understand that there are stations in their neighborhood today where this technology could be installed, and we're going to be fighting for that. Again, we want to focus on COVID and give you an update on some really good news, the progress that we've made in the past month. When I came to you last, we were in the worst of the Omicron wave. Boy, we've come a long way with cases down about 95%. But I do want to point out that hospitalizations, while they're coming down, excuse me, this is our graph on deaths. While the trend on deaths is positive, I'm sorry, if we can go back to the last slide, my mistake. I do want to point out that the toll in this Omicron wave has been quite significant, exceeding already the number of deaths that we had in 9/11. So let's remember to take this virus seriously, even though Omicron appears to be quote unquote milder. This is still a very serious disease, particularly if you are unvaccinated. Now we can go to the next slide. This is data the health department puts out every week, distinguishing between hospitalizations. They also do it for deaths and cases for people who are vaccinated and unvaccinated. And what you see is that this was largely a wave that hit people who were unvaccinated far, far harder. A horrible spike for unvaccinated New Yorkers who were hospitalized at much higher rates. The increase for people who were vaccinated was really not much more than a bump. A reminder of the importance of vaccination, even at this stage. We still have 1 million people in New York City who are unvaccinated. Disproportionately, it is young people. In fact, in the age group of 5 to 11, it is less than half of our young people have been fully vaccinated. This data here, it's giving a 5 to 12 range, a little bit of a quirk in the way the health department reports it, but even if you include 12 years old, we're still at only half. We need to do much more to get young people vaccinated. I know parents who have gotten the shots themselves and don't want to do it for their kids. I understand the hesitation, but know that pediatricians are advising this for your young people to keep them safe and to keep you and vulnerable people in your family and community safe. So please do it. Get that shot. If you do it between now and February 28th, you get $100 for your young person. That's, by the way, true for booster shots as well, if you or your child still has not gotten them. So between now and February 28th, take advantage of protecting yourself and getting $100 at any city-run vaccine site or vaccine sites run by Somos Care. Now, on a much brighter note, I want to talk about an initiative that we're launching with my fellow borough presidents, all 5 of us. Borough President Richards in Queens, Borough President Gibson in the Bronx, Borough President Reynoso in Brooklyn, Borough President Fusello in Staten Island. The 5 of us have come together this week to call for 1 million more trees for New York City. This is about battling climate change because trees absorb CO2. It's about protecting us against extreme weather, which is now here and more common. Protecting us against flooding and heavy rain events because trees can absorb runoff. It's about protecting us against extreme heat because trees actually cool their neighborhoods. But this is also an equity issue. There are neighborhoods in the city, particularly low-income areas and communities of color, where there are fewer street trees per capita than wealthier and whiter areas. You see that in East Harlem. You see that in Mott Haven in the Bronx. You see it in Brownsville, in Brooklyn, the North Shore of Staten Island. So this initiative is also about achieving greater equity in the city. We're calling for 1 million trees on the street to fill in empty tree pits, to build new tree pits, to add trees in parks and wilderness areas, but also in places like NYCHA campuses, on rooftops, on private property. We are really excited to launch this initiative with a great coalition of partners to expand the canopy of trees in New York City. We have a goal to reach 30% of the city covered by tree canopy. We can do it. We can do this in New York City. Let's plant 1 million more trees. So you'll be hearing much more about that as well in the weeks and months ahead. We're now going to open it up to questions. We're going to start with any reporters that might be open. So Winthrop, if you have anyone to queue up, please take it away.
Thank you, Borough President Levine. If any of the reporters on with us right now would like to ask the Borough President a question, if you could raise your hand on the Zoom app, we can get you to ask your question directly.
And while we wait for that, I want to remind folks that members of the public can also post their questions and we'll answer a few if we can. You can tweet with the hashtag Manhattan Update, and we'd be happy to take some of your questions as well. So back to you, Winthrop.
Thank you. Any reporters want to raise their hand? In the meantime, while we're waiting, we have gotten a few questions over Twitter. The first question came in: how should the city be getting more young people vaccinated?
It's really important, and it's on the city to fix this. We are behind in this age group, as I just pointed out. First, we have to improve access. I'd like to see it be very easy to get a vaccination in your school building. We should have mobile vaccine facilities there at schools, particularly those where vaccination rates are lower. Let's make it as easy as possible. Now, that is done with parental permission. We understand that, but let's be there on the ground. But I really want people to talk to their pediatricians, and I want pediatricians to proactively reach out to their patients. They are the most trusted source of medical information for parents and families. So we do really need pediatricians to lead the way in talking this through with parents. These vaccines are incredibly safe. We've had millions of doses in the 5 to 11 age group already, a remarkably good track record. And of course, it does protect you against a virus, which, as we've seen, can be deadly. So let's keep pushing. Because we don't want another wave. We don't want to be vulnerable. We want to get everyone vaccinated here in the city, including young people.
Excellent. Another call to the reporters. Anyone want to ask a question, please raise your hand. In the meantime, we have another question coming in about masks, and if we still need to be wearing masks in the city now that these rates are dropping, and are masks still an important thing for people to be focused on?
They really are. We did have a change in policy the governor announced about a week ago, but there's been a lot of confusion. The governor lifted the mandate in just a few settings. These are private businesses where there's no vaccine screening. So that includes supermarkets, stores, pharmacies, bodegas, laundromats. But the the mask mandates remain in effect in many other venues, including mass transit, subways and buses, in hospitals, and other healthcare settings, clinics, nursing homes, in homeless shelters, in correctional facilities, in schools for now as well. Now, this could change soon, and public health experts are evaluating this day by day, but we're still seeing about 1,500 COVID cases every day in New York City. If it hadn't been for the astounding highs of the Omicron surge, then we'd probably be quite alarmed by that number of cases. So let's remember that while we celebrate our progress, this really is a time for caution. And but we do want people to continue to keep safe, especially in crowded indoor settings.
Great. We have another question coming in, just asking about what are some of the benefits of a subway platform door installation if they were to implement them?
Yes. So first of all, it's preventing the horrific acts that we have seen, including the murder of Michelle Go, protect passengers against that kind of crime. But there's actually hundreds of passengers who wind up on the tracks every year. And this would prevent accidental falls, trespassing, suicide attempts, et cetera. But many objects and trash winds up on the tracks. In fact, trash starting fires on the tracks is the #1 source of delays. So screen doors would make subway service more efficient and reliable. It would prevent track fires. There's an entire team at the MTA who's tasked with retrieving personal items like cell phones and keys that people drop. It's very, very dangerous when passengers hop down to the tracks to retrieve those, and many people don't bother, so you lose your cell phone. Again, screen doors protect you from that. They're in place right now at JFK Airport on the AirTrain. Many of you have seen them. Go and check it out. It really is it's a wonderful, modern innovation. We want to see it in our subway system as soon as possible.
Great. Thank you very much.
I see we had a question from our good friend Jessica Mates coming in about people who have pollen allergies and trees. Excellent question, Jessica. I think we need to understand whether there are certain tree species which are less likely to cause people to have allergic reactions. We learned a lot from the last Million Tree Initiative on what species of trees survive in difficult conditions in the urban environment, in what kinds of neighborhoods and settings. And we should also account for allergic reactions as well. So you have my commitment to ask the experts about that important question that you asked.
Great. We are getting another question from YouTube about the push to get workers back in the office 5 days per week. Remote work has been the one silver lining to the pandemic for office workers. Is this a massive move backwards to start requiring workers coming in for 5 days of work?
Well, look, Manhattan depends on our office buildings having people in them. There's a whole ecosystem of businesses around every office building, from street vendors to restaurants to theater venues. And of course, we want people to come back to Manhattan. We want people to feel safe coming back to Manhattan. But also, the world of work has changed in some ways during this pandemic. And for example, young parents really value the convenience of being able to work from home. And so I do support employers offering that kind of flexibility for COVID reasons for now, but even long-term potentially, again, because some jobs can be done in a more hybrid fashion. So I think we have to adapt as a city, as a borough, to a new world of work. I'm confident and hopeful that the vast majority of workers will return in person, if not 5 days a week, some or most days. And perhaps there'll be an adaptation of the way office layouts are structured to account for that. We're trying to model that behavior here in our borough president's office. And I hope that other employers, including the city, would do the same.
Great. We have another question from Melissa on YouTube who asked about people who are claiming that getting vaccinated does not stop transmission. So why bother getting the vaccination if it doesn't stop transmission?
It's a really common refrain that I hear. And I think the way vaccines were explained early on perhaps are somewhat to blame. What vaccines do is dramatically improve your chances of avoiding hospitalization, serious illness, and death. They also reduce the likelihood of transmission. That's a big deal, and that's enough to make it worth everyone getting their vaccination. But it's not exactly true that vaccines prevent all transmission or all illness. I have been vaccinated and boosted, and I got Omicron in late December. Now, I had a case that I recovered from after 3 days. It's a good likelihood that if I hadn't been vaccinated, I would have had a much more serious case. I'm thankful that I had the vaccine to protect me. We showed a chart earlier that showed dramatically higher incidence of hospitalization among people who are unvaccinated. So I think the messaging is clear. This is about protecting you against severe illness, hospitalization, and death. And that is a lot to ask of a vaccine, and something that we should be grateful for our COVID vaccines have indeed achieved.
We have another question from Twitter from Allison. She notes that trees and all plants need compost to nourish the soil and keep them healthy. She notes that New York City had a great curbside organics collection system and wants to know if you will be calling on the city to restore this curbside or compost program.
Absolutely. We have a goal in the city to divert 90% of our waste from landfills by the year 2030. We are way behind on achieving that goal. We are behind other cities in the US and around the world in our recycling rate. And composting is particularly important. There's a climate impact to diverting compostable materials from landfills, we reduce methane release. And we don't want to go backwards on composting. Our goal should be that every building in New York City has a composting available to the residents. So I'm going to be fighting to avoid the cuts in this proposed budget. We still have time. We're early days. Budget's not passed till June. So we have a time where advocacy can have an impact. And I personally, and I believe many members of the city council, are going to be pushing very hard to avoid any cuts to composting. In fact, we need to be increasing the resources we allocate to this really critical function.
Great. People are noting that a lot of trees that were planted in the first round of a Million Tree Initiative have been lost. Will this program go focus at all on replacing trees and repairing trees that have been damaged since that first round?
It's a really important point. You can't just plant a tree and then walk away. The care and the stewardship for the trees is vital. And it's one of the reasons that I have joined advocates in calling for the Parks Department's operating budget to increase to 1% of our total budget. We are only allocating 0.6% of our city's budget to the Parks Department right now. For comparison, back in the 60s and 70s, we allocated 1.5%. So we're way down from that historic level. By allocating more to the expense budget, we can invest more in the maintenance, the care, and the upkeep of trees. You know, we learned a lot from the first Million Tree initiative a decade ago. I think, and in part, how critical it is that we don't just walk away, that we care for trees after we plant them. We also learned a lot about, I think, where to plant trees and how. We are committed both to pushing for planting more trees, for filling in empty tree pits and replacing trees that have died, and to making sure we have a long-term investment in the care, maintenance, and stewardship of our precious trees in our streets and our parks and everywhere.
Great. Mr. Borough President, that seems to be all the questions that we've received. I'll give the reporters one more chance. Does anyone have any questions for the Borough President? I think that's it.
Thank you, everybody. Give us your feedback, whether this update was helpful, how we could improve it. We're here really to be a source of information for you. Thanks for joining us.